Come winters, aches and pains in your body and joints, specifically stiffness in your joints, become very common. This really isn't a figment of your imagination. The cold weather does aggravate many of these problems in those people who are already vulnerable. And that's the reason why we're trying to find some solutions on how to deal with these niggling issues. Stiff joints, body aches. Constriction of blood vessels can cause restricted blood flow to joints and lead to this stiffness during winters. Are you in pain because there is cold outside? Be assured, it is not a figment of your imagination. Winter-associated aches and pains are real.
There is less of sunlight, so obviously there is less of vitamin D, and vitamin D deficiency can cause the increase in joint pains. There are few patients who are already suffering from rheumatoid arthritis or osteoarthritis. These patients tend to get more stiff joints in winters, which causes the increase in joint pains. And some studies have shown that pollution is a contributory factor for increase in joint pains in winter.
Often, drop in barometric pressure can cause tendons, muscles in the surrounding tissues to expand. Because of the confined space within the body, this can cause pain, especially in joints affected by arthritis. But there are things you can do to get rid of arthritis joint pain during winters.
Take good exposure to sunlight so that you get good vitamin D, which can help in controlling the joint pains or decreasing it in winter. Do good warm-up exercises so that your joints don't become stiff in winter.
Hydrate yourself. Staying dehydrated during winters only increases the joint pain. Therefore, make it a point to consume enough liquids even during winters. Prepare a warm bath. Warm baths relax you and give relief to the joints. Perform joint exercises. Moves which stimulate your joints, such as rotating your wrist, doing squats, or swinging your body left and right. Wearing warm clothes will prevent joints from swelling up or causing any pain. You can also invest in some arthritis gloves. Consume foods rich in omega-3 fatty acids. Include food items such as walnuts, fish and flax seeds in your winter diet plan if you or your loved one is suffering from arthritis. These foods have the ability to reduce inflammation in the joints. When there is sudden change in temperatures and it drops, your body takes extra effort to stay warm, and that's when there is pressure on your heart. Your heart requires special care during winters. So do your different organs, like your lungs, for example. And those with asthma and bronchitis need special care during this time. Take a look. Winter health involves a lot of care for your heart, lung health, and health of your ear, nose and throat, given the polluted air we breathe during this time of the year. Nosebleeds, usually associated with heat and common problem during summers, is actually a niggling problem in winters too. The heated indoor air may dry out your nasal passages and make the tiny blood vessels inside them more fragile. What then are the triggers?
The dust particles or smog particles, when they go into the nasal cavity, it leads to a lot of inflammation as well as a lot of dryness in the nose. Too much of mucus is produced, which gets dried up and causing crusting. This leads to a lot of obstruction and sometimes nosebleeds.
The winter air outside is naturally dry and indoor heating makes things worse. In this situation, humidifiers come to the rescue.
The basic way of preventing is by using a humidifier in the home. Humidifiers Not only, especially when you're using a oil heaters or a heaters, the humidifier gives a wetness of the air which we breathe in.
Breathing easy gets more tough in winters for many. Breathing dry air can cause respiratory ailments such as asthma, bronchitis, and sinusitis. Those vulnerable can see aggravated conditions like those suffering from asthma will see multiple allergies.
In the winter season, because many of us are staying inside, we take out our old clothes, the woolen clothes, where so much of these small reagents can be there, which can cause acute asthma.
Winters also aggravate bronchitis conditions, particularly in children.
Children are young, their lungs are still developing, so any exposure brings lot of symptoms in them. And this winter and changing pollens, as they are more prone to allergic symptoms as well, so that brings more and more problems in them.
Worst, the winter air can harm your heart too. When there is a sudden change in temperatures, the body can make more effort to stay warm, and this is why there is pressure on the heart.
Cold air causes the blood vessels of the body to constrict, reducing their lumen, increasing the blood pressure, and consequently the higher chances of stroke and heart attack.
Doctors say it is desirable to get a general body examination done at the onset of winter. Exercise done regularly is one of the best ways to keep the heart healthy. Vigorous exercises should be avoided. What are winters without your ghee-laden parathas and gajar ka halwa? But with all the warm foods comes unwanted inches and unwanted weight gain. This report talks about how you can still stay fit during winters even after enjoying all these foods. Also, we touch upon winter blues in this report. Winters synonymous with rich, warm foods and a lot of binge. Extra calorie intake, often because of mindless eating, often leads to excess inches and excess kilos on the scale. While hunger is an obvious reason why we eat, there are reasons not so obvious. Well, we often eat to ease stress or because of boredom. And that's the reason why we're going to talk about mindful eating today. Being conscious of what you put into your body is extremely important. What am I eating? Why am I eating this? Is this really healthy? Do I need to have a second helping? Do I need to eat so many portions? Whatever I'm putting into my body, is it really required? Do I need to eat so much, or is this just binge eating? Basically, depriving yourself of the food you enjoy isn't the solution. Eating in moderation really is. Also, conscious eating, which means not looking into your phone while eating your food, or not really watching TV while eating your food. You should just enjoy what's there in front of you, and remember to eat in moderation.
As long as I can manage my day's calories and I do not overgo it in a day, I'm doing absolutely fine. I'm going to be supplementing one meal with my favorite bowl of gajar ka halwa, or probably a good portion of besan ki barfi or til ka laddu. Plus, physical activity is important. I need to work out hard so that I can burn those extra calories and not feel guilty about it.
Eat when hungry. Eat to curb hunger and do not create huge gaps in between meals, say doctors.
Treatment of seasonal affective disorder may include light therapy, some kind of medications, and some kind of talking therapy or psychotherapy. In addition to what the treatment may be, one may try to do all these things or tips which I'm going to give you right now. So take break from news, decrease your screen time, have foods which are rich in vitamin D, such as fatty fish, fish oils, orange juice, milk, breakfast cereals, so on and so forth. Keep up with your sleep routine. Go to bed and wake up at the same time every day. So if you try all these things and still not being able to recover from these things, then you should probably seek some professional help from a psychiatrist.
Since winter blues are often associated with binge eating, here's what you can do to beat seasonal affective disorder or winter blues. That brings us to the end of this edition of Health 360. We hope you find some of these tips useful in helping you sail through the difficult winter months. Stay healthy. Thanks for watching.